All right, thanks. All right, well, welcome. It's great to see you all. I am still around, and so thought it would be great to be on this meeting. Um, and again, I don't expect Hallie or Eileen to be here, and we'll see if Alan is able to join us. But I did want to go ahead and start with the meeting here. Oh, as I mentioned, with regards to the recordings, we're also, of course, doing the minutes as well. So that's also an expeditious way to look and see what we talked about during the meeting. Katie had been doing those, and Adrian will be doing those now. So, for example, with Eileen, we'll probably be able to get her the minutes from this before the video will be posted, but we will be working to get the video posted as soon as possible. So, with regards to updates from the Center for Medical Cannabis and Psilocybin, I just want to reiterate again that the CPPC report from 2025 is available. It is on the website. And the reason I bring that up is because that's where we drew some of the graphs from, or the graphs we pulled the information from the 2024 survey. This is the CPP survey. I think I said report, but it's that survey that we've been doing every year since about 2022. And so they've been doing some carry on graphs for analyzing the 2024 data and comparing it to the 2025. So if you were struggling to find some like what's new, what's fresh, what information is there that's new this year, look at that 2025 survey. Eleni, you look perplexed, and I can send you the survey or send you the link, or I'm somebody's going to beat me and put it in the chat there. Brenda did already, but yeah,
Thank
I
you.
was looking at that because with regards to the opioid and alcohol and tobacco use, they did those same questions this time around, and we can actually show the 2024 data and 2025 data. They have some good graphs there. So the child safety, there could be some new themes from the questions they asked. And even with product safety, Dr. Gill, the product safety, I think they did actually have some Delta 8 questions there. I haven't looked at that specific. Lately haven't looked at that specific area, but let's not forget about that CPPC data as being new data we can use to highlight in this new report, because we might not be finding that much new stuff in some of our other data trails. Consider completing a W-9 for future meetings. I think Alan submitted his W-9, and we were able to reimburse him for his time and his energies. And I think that all of you do such a wonderful job dedicating your time, volunteering your time, that we want to facilitate that in any way, shape, or form that we can here at the Center for Medical Cannabis, and compensate you for your travels as needed. Okay, and so I can send those out again if you would like, but keep that in the back of your mind, because if it's already there and we have one, you'll only have to do it once, and then you would just be direct deposited each time one of the travel events took place. So just something to put in the back of the mind, and send me an email if you want me to resend you the W-9 form. Next is an update on the data streams, and Haley, I'll let you share this because you are sort of our nexus of information on some of these data streams, and so I'll hand it over to you.
Thanks. Yeah, so I don't think I got a chance to send an updated email this morning, but the PRAMS data that I got, I put in a folder on the shared drive that we all have access to this morning. So I got 2022 data from them earlier this week, sort of updated the graph that we had used before. They unfortunately don't have the 2023 available yet. It sounds like there's still a lot of data cleaning that needs to happen. So I just asked, if they could send it to us whenever that's available, because maybe we could incorporate that. 2022 did show another increase, though, in the number of pregnant people, or the prevalence of pregnant people reporting use in the month before pregnancy, is the indicator that they have. And then they sent me some other data that sort of added to the aggregated data that we had before by there was maternal age. I think maybe was it region data or urban rules, some breakdowns like that. So I did update those, but I'm also asking about if some of the single year data might be usable, but I'm not sure if maybe there's like a sample size issue when it's looked at by single year. So I asked for some clarification, but I'm not sure what we'll get. And then for other data, it's just been kind of crazy around here lately, so I just haven't had a chance, unfortunately, to work on like the hospitalization and ED visit data, but I do hope to get to that hopefully next month. So as soon as I can, I will certainly get that to you all. So I'm sorry, it's just all a little bit behind. Dominic?
Yeah, Haley, I have a question for you. Is it possible to get that 2022 data by quarter? And the reason I ask is because the recreational sales starting later, in April of 2022, it would be interesting to see if, the first quarter sort of fit with, and maybe it would be good to get, if it's possible to have the quarters for 2020 and 2021 to sort of see if they stayed about the same, since 2020 and 2021 were at 15.8 and 15.5, and see if those stayed the same in those first quarters. And then if the increase was afterwards, or if the increase was sort of through the whole year, including that first quarter. And I don't know if that's difficult or any of that. And I don't want to, I mean, it's just sort of something, as I looked at this graph real quick, I went, oh, wait, I wonder, that little, that point in time might actually make a difference in it, and actually would indicate that there was an increase with the onset of adult use or commercial use of cannabis. So,
Yeah, I'll ask the Prams Epi if that's something they're able to pull for us. So yeah, I can definitely ask about that. I know at one point I did look at it in the Burfis data, which is the adult survey. And I know at one point when I looked by month, once you got to like the May survey group, which,
mhm.
it's asking about past 30-day use and sales started in April, there was like a jump in May.
Gotcha.
I
Yeah,
can't remember if it's sustained or not from there, but yeah. So that's something also maybe if I look at the Burfis data
might be
again,
able to, yeah,
look at
cross
that as well.
correlate.
Yeah.
Yeah. Great. Thank you.
All right, and I'm going to go ahead and share my screen to show you all where this new information that Haley has shared, where to find it, and then we'll go from there with regards to other items. Oops. Okay. So here's the 2025 report. These are the different sections that we've all grown so accustomed to. And here's the new data from Haley, the spreadsheets right here, the new PRAMS data. So it's there. And again, this can be compared with our 2024, well, compared with last year's, and see if the trends still are consistent, and perhaps utilize this for the sections in this year. Um, Now, that being said, it looks like everybody has been able to link to the website. Good afternoon, Alan. How are you?
Hello, I'm fine, thank you.
All right, well, thanks for joining. I was just showing everybody where some new spreadsheets that Haley had shared with us are located on the SharePoint site. And I know that Dr. Gill, we got you, Sabrina, we got you access. Alan, have you been able to access the SharePoint site?
Yes, I have.
Perfect. Okay. I think we all have done so then. Um, and so that's great news. Um, so that being said, again, our timeline for work, I'm just going to run through it real fast. The goal for the end of month of August was for individuals or teams to submit their first drafts. And I believe we have nearly first drafts for each one of the sections here. We'll go ahead and take a peek at some of those. But the goal for mid-month September was to have all sections domains finalized. And then October 1st, week of October, was to submit the report to the program. Um, So again, in looking through some of these, and I'm just going to go ahead and open, child access up, Eleni, because this is what Eleni had put together. And I think this really is sort of a blueprint that we could follow with some of our other sections here by, again, identifying the recommendations and, again, highlighting those recommendations that the committee came together to really acknowledge as ones that they want to address this year. And then there's the outline, and here, sort of include the new data. And so that looks great. And I think that workplace safety, here is what Hallie had been working on. And again, similar, with regards to the recommendation. And here again, everything's not rewritten from the last year's report, but this is what could be sort of interwoven into it to make it a little more updated. Again, we were talking earlier, we don't think, and Sabrina, I did see your hand was up. I don't think we need to reinvent the wheel. We just need to update it with the new data that we have. And again, that CPPC report, as I was looking at it again, I think that we can weave stuff in from that and make the paper new each year, because we're doing that each year. And actually that is, we're getting a lot of multi-year data from that survey. Sabrina, did you have a question?
Can you hear me well?
I can now, yes.
All right. Yes, I think I needed that clarification on if we wanted there to be any repetition between the years. And it sounds like we want to use last year as a template and be very judicious with making useful updates to it.
Yeah.
That was
Yeah,
sort of my plan with the writing, if that's kind of where everybody is, to sort of try to streamline it a lot, which I think might make it more accessible as well to potential readers.
I think one main theme too is also avoiding duplication in the sections. I noticed that Eileen really came across that. I mean, it was wonderful that we had duplication there because the material, we had the material definitely down. But I think that just putting it in the right section really, avoids the redundancy and the problems that can come with that if we're always repeating ourselves. So Eleni, I agree with that. I think that approach is sort of really, in looking at what people have come up with these outlines, is really what we sort of settled on, or would be work well. And again, and here we go, poison control centers. So again, adding some figures here and adding the data and then comparing it from previous year's data. Again, acknowledging the trends that we're seeing, perhaps, because a lot of that background information won't change. Now, I guess the question would be is, I think you could sort of, in summary, use some of what was from the 2024 and then focus on this. Dominic, how would you just say, oh, please refer to 2024, but this is new, or would you intertwine, weave the two together?
I would agree with you, Gary, as far as, reference it from last year and say, please see last year's report and here's some new information. That way you're not, people aren't having to sift if they're trying to see what's new. They're not trying to sift through the old information just to get to the new pieces.
I think that some of that we're going to be comparing. So, in the writing, you're going to be comparing the 24 to 2025 and the like. So,
yeah, and if it's a comparison, I mean, obviously then you want to have that in there. But if it's something that's new, like brand new information or data in an area that, where we said there was no information previously last year, that's where I would really emphasize, see last year's report for other data that's not being compared. But here's the new data, and here's the data that we are specifically comparing. Does that make sense?
yeah.
Yes, that makes sense.
And here, I'm just sharing this. So for example, Hallie, he came across this new updated report by ACOEM, And so I think that a goal of his was to incorporate this new report, and that was sort of, you know, what his new information was. Um, but again, he sort of references the 2024 report and then adds this in as the update. And again, I think it's powerful, and we're not having to reinvent the wheel each time, and then can really focus on what's new. And I think that's going to make the report fresh each year as well. I'll stop sharing. But yeah, does anybody have any other questions or concerns?
I'm sorry. I think maybe because I'm newer, I need more help. Um, and I'm joining from very near the Olympic Peninsula. So I'm a little on the go as well. Um, you already answered this question, but I wanted to clarify if we wanted to repeat any information from the MCP reports, or I'm not sure what to call, that's just what the title is, the Cannabis Public Policy Consulting Report. But it sounds like the parts of that that are applicable to us, we do want to include in our, or like kind of use pieces of that data in our report also, because like you said, it has data about potency and types of cannabis in there that that are relevant. I just wasn't sure if we wanted to repeat them.
Yeah, I mean, again, oh, Devin.
Oh, Gary, I'll answer it. So what I would say, Sabrina, is if you're bringing in like specific data points, absolutely include them in, reference them to the report, you know, or even like if it's a table, one of the tables, and you're saying, I want to reference this in the narrative of what the portion you're writing, it's going to be easier for someone to see what's on the data table right there and with the narrative. And so I think that's fine. But if it's just sort of saying, you know, we found this, you know, or as was found in the survey, and you're, you know, putting it there, then we can just link it, you know, and have that citation and the link to the report where you're not pulling in like paragraphs and all that. So I would say just like any other bits of research, you know, you're pulling in the important pieces. But if there's something where you want to say, oh, we saw this, you know, you can clearly see in this data table, and we repeat a data table or even you know, a couple of sentences or whatever, absolutely pull those on in. And then otherwise we'll just reference to it and do the link to it. Does that make sense? And the nice part is because it'll be a digital document as well, we can even put the link in the document and it'll take them right to the web page if they're looking at it online.
That sounds great. Um, and then one more quick question for now. Is like an editable or like Word document version of last year's report in the SharePoint? Or where are people getting that from to update it?
I believe there is a Word version in the 2024 folder. Let me look in the 2025. And
It's in the 2024.
it's in the
folder.
2024. It's a PDF in the 2025, but I can move that 2024 Word over for easier accessibility if that helps. But it is in the 2024 folder.
Well, as long
Did
as
you
I have
want?
access, that's fine. That
Yeah,
works.
here I'll just show you where. So here's the 2024. Go down here, 2024 final report, and you have both the PDF and the Word document there. Only the PDF is in the 2025. But you know, I think that
Are we
yeah, we
wanting a
might.
copy of that in the 2025 folder so folks can copy and paste their content in there?
I think that would work. I think, yeah, because that way you're in the same report. It's easier to maybe get at. Would that help, Sabrina, if we moved a Word version of it to the 2025 report as well?
For me, either way works. Honestly, it might be the clearest just to have it in just one place. So I wouldn't necessarily change anything if other people know where to find it.
See it being useful having both versions there. If we have the PDF, then we have the Word as well. We typically keep both versions on our SharePoint site for our internal stuff as well. So I or Kathy will take care of that and get that done and just move that over. It's just a couple clicks, and then you can cut and paste what you need to out of that when you're working on the section. Oh, and I was going to share here as well. Road safety. Alan, this is what Alan has been working on. And again, everybody's sort of on the same wavelength. This is really great to see where we have, highlighting the recommendations up here and then providing this new information from 2025 here, and then also the DPS data down here. We do have that DPS data and probably just need to put it in a chart form, and then we can, even throw that in the 24 versus 25 or just the new data. But it looks like the citations were pretty much following the same. So again, I think that everyone's providing our editors with what they'll need to put the paper together. Eleni.
Yeah, I had a question, actually, it's like nitty gritty, but about the citations. I know that last year's report, like Eileen had to spend you and Eileen, a combination of the two of you had to spend this huge amount of time like compiling all the citations into like a single citation list at the end. I was thinking about just leaving my citations as like author, last name, and year instead of numbering them. But I see that everybody else's are numbered. Because I usually leave it as like author, last name, and year while I'm like editing anyway, so I can so I know what I'm referring to and then only number it at the end. That makes sense.
I hear what you're saying, and I just wonder if maybe how your approach might be in going forward. What is going to be the best approach? Because the original document was like 100 pages long, and then it got truncated down to about 35. But we had over like 130 references, and then that got cut down. And in all that editing process, you sort of had to hunt and hunt and delete those references and then get them out of the list as well. I hear if people are doing these sections sort of individually, should they just reference it at the bottom of the page and then compile everything that way rather than having them all at the end? Is that sort of what you think might work for years going forward? Because
I was just going to, I was just going to leave it formatted as, it's been so long, I don't remember like what formatting this is, but at some point in college, maybe it's APA, it's like the references are the last name of the author and the year the paper was published, as opposed to like 1, 2, 3, 4. And that's easier to sort of pinpoint the reference regardless of like what your list looks like. And so that's usually how I write, and then number it in my final draft at the very end. I could just leave it like that and you could look at it, and if you hate it, I can put numbers in.
What do you think, Dominic, would be easier for the legislators to absorb?
So I think as long as we're consistent, quite frankly, either way works fine. And Eleni, yes, that's APA. And I'll be honest, I'm used to using APA myself in doing that. I think the concern that comes in the past, which is where we've been asked to do it through the numbering sort of methodology, is when there's been authors who have either similar or the same names or multiple years, where then people were getting confused with which document actually went with which particular citation. But I think, quite frankly, either way that we do it is fine, just so long as we're consistent within the document. So I really would leave it to you all to say which way would you like it, and we can even go back in afterwards and reformat it all to make sure that it all works and that the numbering is correct and sequential, all of that aspect, as long as we have it. So Eleni, I would say don't focus on going back to redo the citations, leave it as you have it, and we can go back and do that at the end, because once the document's assembled, we have to renumber them all anyway. Does that make sense?
Yeah, no, yes. I think the final document should have numbers as the citations, because I think that's what everybody is used to. I was just thinking during the process to like make the renumbering easier. I think I made things more confusing. I'm sorry.
No, not at all. Not at all.
I'll just put it in, and you can tell me if you want me to change it.
Yeah, no worries.
Okay. Well, again, so I think it's August 24th. By the end of the month, we definitely wanted the rough drafts, and I think that we're just about there. We've identified another new source of information, which can definitely be that survey that can help if you know, are trying to find some new information. And I think that everybody's been addressing the recommendations. So I Oh yeah, yeah. Haley had to go, but again, she wanted to. We had this meeting at 3:30 so that she could be with us because she leaves it typically at this time on Thursdays, and so I'm so glad that we had her with us as long as we did. Um, and again, I would expect her to get some of that ER data that will be, you know, she'll let us know when she posts it. And we'll get that information out. So really, I guess the next thing to talk about would be when to have the next meeting. Again, the next goal was to have all sections finalized by mid-month September. So do you think that a meeting before that mid-September timeframe would be most helpful, or a meeting after that those sections are more developed and finalized? What's your all's thoughts?
Maybe
Yeah,
slightly after.
slightly after, like give people time to really develop the sections and then have the meeting a little bit after, and then that way talk about you know, editing and so forth at that point. That would probably work just fine. That would provide some opportunity. I know we have the Labor Day coming up. There's, you know, so it might be worthwhile to give people a little bit more time. Um, I'm not going to be here, so it's hard for me to throw out some dates, but I do think the Thursday seemed to has worked well. Um, I do believe Eileen has scheduling conflicts with 3:30. I think she's, you know, so 4 might work better for her. I'm just sort of speaking on her behalf. And then I don't know, Howie, he's quite a traveler, but I don't know if he'll be around or not. Sabrina, works well for you. Is Thursday at 3:30 work better, or Thursday at 4? And look for
Um, either should be good for me. 4 is a little better, but either should work.
So Gary, since we know, you know, there's some conflicts at 3:30, and since 4 o'clock works a little better for Sabrina, Eleni, unless you have an objection, I would say, why don't we go for 4 on Thursday, the 18th?
18th. Yes.
And what that would do, oh, you have something going on the 18th, Eleni?
The 18th specifically is bad for me. We're traveling for a wedding, but that should not dictate everybody else. I just probably wouldn't be able to make it
Gotcha.
that day.
Yeah, and the thing I was going to say too with it is I think that we're at a point where probably an hour-long meeting, since it's really focused on just doing a review, would probably work a little better. Um, I, I don't know. What do you think? Do you think, I mean, even with Eleni, if you're not able to make it, I mean, you're doing a lot of the contribution in the document itself, and I think we could just review that, and if there's issues, reach on out separately to see if that would be okay. Just that way to have that touch base so that we can sort of get that kind of going. And the main reason I say it is because I have to admit, I am actually gone the week before and the week after. And because we're going to be in a little bit of a transition, I just want to make sure that I'm able to be here to take that handoff from Gary and all that, if that works okay. Otherwise, I'd say let's just go for the next week, but I just want to make sure we're able to do that. So would that be okay? Alan, we're talking about, so Thursday, the 18th of September at 4 o'clock. Would that work for you?
I think that would be okay, yes.
Okay, so let's go ahead with that then, if since that seems to be okay otherwise. And Eleni, we'll just make sure we touch base with you if there's anything else and fill you in.
That sounds
You
great,
know,
and I can watch the video after too.
Yeah.
Thank you.
yeah, and the minutes. And again, a lot of the conversation there might be more of the editing, and that might have more
Mhm.
to do, more impact really with Hallie and Eileen. So, but safe travels. A wedding sounds fantastic. It should be a gorgeous month. So, um, all right. So tinted and September 18th then at 4. I'll make sure to share that with Eileen and Hallie. All right. So that being said, just I think that we can adjourn the meeting. I think that we've got things discussed and used this time to develop the sections a little bit more. So did any of the health educators, did you have anything to share? No. Okay.
Well,
All right.
Gary, I just want to say, I know we kind of said this at the last meeting, but I really appreciate you having stayed around for the last few weeks. And really, you've been so integral into all the work that we've been doing, and not just with this committee, but everything. And so I just really want to, once again, in a way that will be public, since this will be on our website, thank you so much for all the work that you have done and everything else. We really appreciate you, and we're going to miss you a whole lot. And I know me personally, I'm just going to miss you horribly. So, but thank you.
Well, thanks. And again, I'm in wonderful company, and that's what makes it. This everybody on this call. So thank y'all.
I agree with
Right.
everything that Zerlo said, and we'll miss you greatly. And just feel really, really good that we've had your leadership with us this time.
Thank you. Thanks. Oh, Adrian.
I just want to augment those sentiments. It was a privilege working with you, Dr. French, and I hope not to lose contact with you after it. And thank you for all your insight and guidance. It truly means a lot. I appreciate you.
All right. Well, hopefully I'm passing it all on to you and the team here so that I'm not missed at all. But I appreciate that, Adrian. Thank you. All right. Well, have a wonderful, wonderful rest of your day. Safe travels home or wherever you may be going. And again, please take care. I'll miss you all.
Thank you, everyone.
Bye.